I loved working in our healthcare ministry because of what we did for patients.
I loved my ministry in nursing and chaplaincy because it helped me give witness to living the gospel.
I worked as a certified chaplain, the body of Christ. In this ministry, I learned that I can be one with the sick, the aging, and their families.
I loved working in physical therapy, helping people regain their life and their strength again.
It's hard to believe how many sisters in our congregation gave their life to healthcare.
There are countless stories that I have heard from our older sisters about things that they did, carrying stretchers up and down hospitals that had no elevators, sisters that were the only cook in a hospital that was servicing maybe 60 or 70 beds, but they did it. And they were proud of doing it. They were happy to do it.
They moved what was unmovable. It didn't matter where or what our sisters were called to do. They responded because people needed them.
Since 1916, the Franciscan Sisters of Sylvania, Ohio, have served the people of God in education, pastoral work, social services, and healthcare. These ministries all trace their roots back to the leadership of one remarkable woman.
The Sisters of St. Francis of Sylvania, Ohio, were founded by Mother Mary Adelaide Sandusky. She was a Rochester, Minnesota Franciscan, an artist, deeply grounded in her Franciscan spirituality.
She was only 40 years old when she was appointed provincial superior.
She was approached to start a new province down in Toledo, Ohio, the growing industrial area. Many immigrants from Europe came here seeking jobs. A lot of them were from Poland, and they were interested in Catholic education for their children. 23 founding sisters began working in 3 parish schools in 1916.
That became the origin of the Sylvania Franciscans.
World War I was just finishing up. Many of the soldiers who had fought in Europe came back home and brought with them what was called the Spanish flu. It was ravaging the country. The estimate is that 500,000 people in America died because of the flu.
Within the Toledo Diocese, the small factory town of Gypsum, Ohio, isolated and far from any hospital, had been hit particularly hard by the flu. Bishop Joseph Schrems appealed to Mother Adelaide to send sisters to Gypsum to care for the residents.
The very next morning, Mother Adelaide took off with 5 sisters and arrived at the town. The sisters engaged in what was really home health. They used common sense and some nourishment for the people, and all 98 of them survived. It was a good sign for the future of the sisters, a new ministry for them. They had been successful in education and were now called upon in many communities to come and staff hospitals.
Before formal requests even began, Mother Adelaide had made the decision to send some sisters for healthcare training.
When they came back, the first hospital that they took on was one in Ashland, Kentucky.
The sisters arrived there in 1921, but the stay would be brief.
We were only there for 1 year. We simply didn't have people to staff it. But by 1923, there was this core of people who were able to run a hospital and did so with great success.
The next request came from Sandusky, Ohio.
Mother Adelaide was asked if the sisters could take over Providence Hospital. The sisters left Ashland, much to the regret of the people there, and came to Sandusky, and it was really the first permanent start of the sisters in the hospital ministry.
When the 30s hit is when our hospital boom actually began.
The sisters expanded their ministry into Texas. 1931 was also the start of the Sisters Healthcare Ministry in Steubenville, Ohio. It's amazing to think about this growth in the 30s. This was the time of the Great Depression. The sisters were not being paid generously. Many of the people who came to the hospitals couldn't afford to pay for the services that they received. And yet Mother Adelaide and the sisters were determined that God's people would be cared for.
Mother Adelaide and Sister Laurentia were the people most responsible for financing any institution. They were the ones who would take the trip to Bryan, Texas, or to Brenham, Texas, and would negotiate. Each one of those was incorporated, and the deeds all say Sisters of St. Francis. In today's society, quite frankly, I don't think anyone would trust themselves to take on that much responsibility, especially when you consider they weren't trained in business. They didn't know corporate law or corporate finance, but somehow they managed to track their way through this.
40s and 50s saw the sisters extend into other states.
By the time 1950 rolls along, 1/3 of our sisters are in healthcare. So when you think about it, within 20 years, there was a sizable workforce that had really been trained and educated.
By the 1960s, Sylvania Franciscan sisters had provided health care in Ohio, Michigan, Louisiana, Texas, Arizona, and Nebraska.
Over time, the sisters were approached by a number of communities to come and either take over or start hospitals. And when they could take care of the community with appropriately trained sisters, they went. When the need changed, they withdrew and found another location where they could serve.
When you get up into the 1970s, it becomes a more complicated process, and we have Medicare and Medicaid laws going into effect, a whole lot more government oversight.
It was an era where marketing awoke, and hospitals were trying to convince doctors and patients to come to their places. So there was competition, one hospital against another.
The overall management of these hospitals was the responsibility of the elected leadership of the Sisters of St. Francis. So every 4 years, there's a new group of people who have the responsibility of governing these institutions.
When Sister Patrice became congregational minister in 1976, she was very visionary and started to say, if we are committed to our healthcare ministry, is this the best way to operate?
They did a study, a very serious study of how they could best oversee the healthcare facilities that they had established. They recommitted to healthcare as a ministry that they wanted to preserve.
In 1984, Sister Patrice Caron led a collaborative effort to develop a healthcare system that came to be known as Franciscan Services Corporation, and a national search for the first CEO was launched.
I credit John O'Connell with really giving the system legs. He really had the heart of the Sisters of St. Francis. Every communication, every conversation was always respecting the sisters. I am here as a steward of the sisters' health ministry. Sister Patrice, with her vision and her charisma, was the perfect person to step in and be the first chairperson of the board.
The corporate staff of Franciscan Services Corporation was small at first, but over time they extended their services and outreach into the areas of finance, insurance, quality, and mission integration. As needs changed, some of the hospitals were sold or closed, and new hospitals came into play. In the 1990s, the healthcare system initiated a new area of ministry, elder care, which was formalized in 2000 as a separate region.
In the name of the Father, and of the Son.
This is a growing enterprise. It's a greater need in our society these days as our population ages.
In 2011, the name changed to Sylvania Franciscan Health to better reflect the mission of the system in terms of population health and relevance in the market. In 2012, the sisters and the leadership realized that on their own they would not be able to remain strong in the new healthcare environment. A decision was made to search for a Catholic healthcare partner, and was finally concluded with the selection of Catholic Health Initiatives.
Becoming part of CHI, a $15+ billion company, it just dramatically changed our ability to be able to really do exactly what we set out to do, and that's take care of the people that come to us for care.
This organization was chosen because its values and the values of Sylvania Franciscan Health matched so closely, and because CHI has always had a respect and a support for the founding congregations.
What we found with CHI was that we can still be Franciscan in our ministries.
The Sisters of St. Francis became the 13th participating congregation in Catholic Health Initiatives. The transfer of sponsorship was effective November 1st, 2014.
Yes, it is a big business now, but it still comes down to one individual taking care of another individual, one sister ministering to one patient or resident. At no time should the element of a personal relationship ever be lost. That is totally un-Franciscan. That's not who we are.
I think of it in two words: incredible stewardship. That if you ask Sylvania Franciscans to do something, they don't just do something, they do something. It's incredible what our sisters do.
I remember one sister telling me a story that she had been sent to St. Francis Hospital to run the X-ray department. And Mother Adelaide told her, well, this is what you're going to do. This is your obedience for the year. And she said, Mother, I don't know anything about this. And the response was, it's taking pictures. What's so hard about that? And, and by golly, they pulled it off. There have been hundreds of sisters who have really laid down their lives, in a sense, for the cause of ministry.
I worked as a technician in X-ray department and nuclear medicine.
I worked for 25 years as Director of Mission Integration.
I served as a certified chaplain for 25 years.
I served as Vice President for Mission Integration.
I have spent 47 years in healthcare, 21 years in nursing, and 17 years in chaplaincy.
I served as an emergency medical technician, a vice president, and a CEO in healthcare.
I served in physical therapy for 24 years.
I worked as a vice president for 5 years, a chief operating officer for 8 months, and a president and chief executive officer for 16 years.
I serve in mission integration.
I worked for 8 years in pastoral care.
I worked in the emergency room, labor and delivery, and med-surg, critical care.
I also worked in nursing as a surgical nurse, an ER nurse, and med-surgical nurse.
I worked as a medical technologist.
I worked in physical therapy, mostly in wound care and aquatic therapy.
I love the healthcare ministry because it gives me the opportunity to enter into people's lives and they into my life.
I love being with people, so I enjoyed visiting them, praying with them.
I loved serving as a chaplain because I was able to walk with so many people through difficult times in their lives.
What began with a small home health outreach in Ohio has now extended 100 years and is now part of a national healthcare system.
Mother Adelaide, with her wisdom and vision, invited our congregation, being just born, into a response to taking care of the people of God.
I think if Mother Adelaide could speak to us, she would probably say, well, I expected you to do this. That's why we came here. We came to serve. This is what we were supposed to do. I think she would be delighted that so much has been done, in a sense, by so few.
It took generations of sisters to take that vision into the new time.
Now that Sylvania Franciscan Health is part of CHI, our legacy that has been such an important thing to our sisters and to all of our entities over many decades will now be preserved.
I'm encouraged and I'm enthused that we have partnered with CHI. Our mission and our values are really incorporated into theirs. I think it'll be a wonderful journey.
And remember what Francis said, I have done what is mine to do. We were all doing what was ours to do. And the end result, I think, will work well for our ministries long into the future.
We are alive with Mother Adelaide's vision, and we are looking to match that vision and that mission and ministry with an ongoing call to the future.